Okay, thank you so much. I'd first like to acknowledge that we're in Ottawa, a city that was built on unceded Anishinaabe Algonquin territory. The peoples of the Anishinaabe Algonquin Nation have lived in on this territory for millennia. We honor and acknowledge them and are both grateful and accountable to them. My name is Janet Butler-McPhee, and I'm the co-executive director of the HIV Legal Network. We promote the human rights of people living with HIV or AIDS and other populations disproportionately affected by HIV, punitive laws and policies, and criminalization. We do this in Canada and around the world. While we're here today in advance of World AIDS Day, which is marked on December 1st, human rights and health are important every day of the year. The state of HIV is important in Canada because the world often looks to us as a leader in both words and deeds. But cases of HIV have been steadily rising in this country for some time now, and we are not on track to meet our global commitments to end HIV as a public health threat. You'll be able to read more about this in our forthcoming report, The State of HIV in Canada, Rights, Progress, and Unfinished Work. Today, my colleagues will talk about some of the recommendations we put forward in that report. I'm now pleased to introduce my colleagues in speaking order. First, we'll have Sandra Kahan-Chu, Co-Executive Director of the HIV Legal Network. She'll be followed by Cecile Kazachkin, Senior Policy Analyst at the HIV Legal Network. Cecile will be followed by Andre Capretti, Policy Analyst at the HIV Legal Network. And we will leave the last word to our colleague, Maluba Hamenyama, longtime HIV advocate and current chair of the Canadian Coalition to Reform HIV Criminalization. Sandra.
Thank you so much, Janet. So I'm here to set the stage and share some facts with you on World AIDS Day and how Canada is faring in the HIV response. Today, about 65,270 people were living with HIV at the end of 2022, and an estimated 1 in 10 did not know their status. After a period of decline, Canada saw a 35% increase in new cases from 2022 to 2023. That translates to 1 person infected every 4 hours. The lifetime cost of a new HIV diagnosis in Canada is $1.44 million. Based on the number of new cases in 2023 alone, that means $3.5 billion were paid in costs for the cost of new HIV infections. These numbers might seem meaningless without actual benchmarks, and there are many. We pledge as a country to meet certain global targets by 2025, and these targets include 95% of people living with HIV diagnosed, 95% of those diagnosed on treatment, and 95% of those on treatment virally suppressed, and no more than 5 new cases of HIV per 100,000 population. The global targets also include a goal of fewer than 10% of countries with punitive legal and policy environments that affect the HIV response, and those punitive laws and policies include criminalization of HIV non-disclosure, sex work, and drug use, which my colleagues will talk about later. Sadly, we have failed to meet these targets by virtually every metric. In Canada, the latest figures show we are at 89%, 85%, and 95%, with 6.5 new cases of HIV per 100,000 of the population. Our own public agency, Health Agency of Canada, has acknowledged that Canada's progress towards achieving the 95, 95, 95 targets has stalled since 2020. As our next speakers will share, we also continue to criminalize key populations contrary to global recommendations. Great disparities also exist between provinces and territories, with Manitoba and Saskatchewan leading by far in the number of new diagnoses nationwide, with HIV case rates respectively 5 times the global target. Notably, Indigenous people in these provinces are also massively and disproportionately affected. No province or territory has met all of the 95-95 targets. Based on the available data, BC is the closest at 95, 94, and 96. Moreover, the most marginalized and criminalized are most impacted by HIV, especially Indigenous populations, Black people, people who use drugs, sex workers, people who have experienced incarceration, transgender, gender diverse people, Two-Spirit people, migrants, and increasingly women. Patterns of transmission are also evolving, with injection drug use being the second most reported HIV exposure category among women in Canada. These populations face enormous legal and policy barriers to essential HIV prevention, care, and support services. Laws and policies that criminalize HIV non-disclosure, sex work, and drug use create barriers to testing, drive stigma, hamper the implementation and scale-up of harm reduction services, and increase vulnerability to HIV. At a time when the world has seemingly turned its back on people living with and affected by HIV, when governments, including ours, have cut funding to long-standing global health institutions and services, and when the Trump administration has decided to no longer commemorate World AIDS Day. Ending the HIV epidemic in Canada is both a public health imperative and a matter of human rights. We need Canada's leadership more than ever, as each missed opportunity for prevention and treatment deepens inequities and delays our shared goal of ending the epidemic. Our next speakers will touch on key responses that Canada needs to adopt to reverse our delayed progress. Over to Cecile.
Thank you very much. I'm here to speak about some of the legal barriers that prevent Canada from reaching the global targets, and I will focus on drug policy. So we heard people who use drugs are disproportionately impacted by HIV. We heard that injecting drug use is the second most reported HIV exposure category around women in Canada. And yet, drug use continues to be largely treated as a criminal issue with immediate impacts on the health of people who use drugs. Extensive evidence shows that the reliance on criminal law enforcement carries enormous financial cost and takes a terrible human toll on people who use drugs. When people fear police, that increases isolation. It prevents access to services. And incarcerating people for drug use also poses great risk to their health. Black and Indigenous people in Canada are disproportionately charged, prosecuted, and incarcerated for drug offenses. They are also disproportionately impacted by HIV. In addition to the federal legislation prohibiting simple possession, even for just personal use, we are concerned to see provincial and municipal laws and police operation punishing activities related to personal drug use that occur at the intersection of poverty and homelessness, as well as growing attempts to authorize involuntary treatment and detention of people who use drugs. These laws and operation increase repression against the most marginalized people who use drugs. And the current context in Canada is also marked by growing attempts to limit access to harm reduction services. This is extremely concerning with regard to our efforts to end the HIV epidemic. Harm reduction is an evidence-based public health approach that reduces the health, social and economic harms associated with substance use. It's vital to combat HIV. We've known, for example, needle and syringe programs have operated in Canada for nearly 4 decades, providing new drugs use equipment to prevent the spread of HIV, hepatitis C, and other infections. They are amongst the most effective and well-established harm reduction programs in the world, with extensive evidence showing their benefit for both individuals and public health. And yet, despite overwhelming evidence of effectiveness of harm reduction to prevent HIV, we are seeing new barriers impeding access. We are seeing supervised consumption services being dismantled in Alberta and Ontario, for example. We are seeing new barriers to needles and syringe program and other services providing access to safe drug equipment. People who are in prison also continue to be denied access to health care available outside prison. Despite documented drug use and injection in prison, the Correctional Service of Canada is the only jurisdiction to operate a prison needle exchange program, currently in 11 of 43 federal institutions. However, the program remains largely inaccessible, falling short of the federal government commitment to expand needle exchange and overdose prevention program in all federal prisons. We know what works. Let's not turn back. Protecting and promoting the human rights of people who use drugs is necessary and effective in both upholding their rights to health and preventing HIV. Thank you.
As my colleagues have highlighted, Canada's progress on HIV has stalled, and stalled in ways that reflect deep structural problems in our response, including problems in our legal and policy environment. And one of the harmful pieces of that environment is the ongoing criminalization of HIV non-disclosure. For decades, people living with HIV in Canada have faced the threat of being charged, prosecuted, publicly outed, and even imprisoned for alleged non-disclosure, including in cases when there was no realistic possibility of HIV transmission, no intent to transmit, and even where no transmission occurred. People living with HIV live in fear that their status could be weaponized against them. And yet the science is clear. People who take reasonable precautions to prevent HIV transmission, including maintaining a suppressed viral load, using condoms, or engaging in activities with negligible or no risk of transmission, should not face criminalization. Yet again, the law does not reflect this scientific reality. The criminalization of HIV non-disclosure is not only discriminatory and scientifically outdated, it also undermines everything that we are trying to achieve. It drives people away from testing, from treatment and care. It amplifies stigma and places the greatest burden on the communities already facing the most significant HIV-related inequities, and that includes Indigenous people, Black communities, migrants, women, and the 2S LGBTQ+ community, among others. Those most marginalized communities are also those that are most criminalized. That is why one of the central recommendations in our forthcoming report is to reform the criminal code to end the criminalization of HIV non-disclosure in line with scientific evidence and human rights standards. This reform is a key part of creating an enabling legal environment in Canada, the very conditions that are required for a rights-based, effective, and sustainable HIV response. Without that enabling environment, we cannot meaningfully combat stigma and reduce new infections. And the truth is, this reform is entirely within reach. Criminal code reform requires no new financial investment. It does not demand massive resources or years of administrative buildup. Community stakeholders, including people living with HIV, activists, legal scholars, medical professionals, public health experts, and frontline providers have already done the heavy lifting. The Canadian Coalition to Reform HIV Criminalization has developed clear, practical proposals grounded in evidence and human rights. The solutions are already on the table. We have decades of evidence and broad consensus, including from previous federal justice ministers, that the current approach is harmful and outdated. What we need now is political will for the federal government to sit down with stakeholders, consider these proposals seriously, and act now. Criminal code reform is a rights-based obligation. It is a structural change that will meaningfully contribute to the success of our HIV response in Canada. If Canada wants to lead globally in the fight against HIV, that leadership must begin at home. It starts with removing laws like HIV criminalization that undermine public health, entrench stigma, and deepen inequality. The solutions are here, the evidence is clear, and the time to act is now. Thank you.
Good morning, everyone. Thank you for being here today. I come into spaces carrying many identities, professional titles, personal roles that mean a great deal to me. But I show up in this country, in this world, first as a Black woman born with HIV. And I'm not complaining. I stand before you without shame or embarrassment. Being a Black woman living with HIV is an honor. However, it does shape how I navigate systems that were never designed for myself or people like me in mind. And it shapes why this work is so deeply, urgently personal. This year's World AIDS Day theme is Overcoming Disruption, Transforming the AIDS Response. But let's be honest, the biggest disruptions we're facing right now are not natural, and they're not inevitable. They are choices. And those choices have consequences. Consequences that are costing lives. Consequences that are killing people. You cannot cut resources and expect the epidemic to magically improve. You cannot cut funding and then expect frontline workers to perform miracles with scraps. You cannot criminalize people and pretend it's public health. And until we act, we are undermining every prevention message and every care strategy we claim to support. That's why transformation isn't a theme, it's a demand. People were never the disruption. People are not the disruption. The disruption is everything that keeps people from living full, safe, dignified lives. Communities have been transforming this response for decades. The question now is whether our systems, our leaders, and our country is willing to catch up. I urge policymakers to read our recommendations and actually act upon them. We need action from all levels of government. We need leadership from the federal government. And if we're going to reach our commitments, honor human rights, and end HIV in Canada, the transformation we need is long overdue. And people like myself have been waiting our entire lives for Canada to catch up. The question is no longer whether change is possible, but whether we are willing to choose it today, tomorrow, and forever. Thank you.
All right, I have no question in the room. Just a quick reminder for people joining us online. If you have a question, please use the raise hand function. Pour les gens qui nous joignent en ligne, s'il vous plaît, utilisez la fonction main levée si vous avez une question. This will conclude our press conference. Ceci conclura la conférence de presse. Merci beaucoup. Thank you very much.